Sometimes what's common here in Nigeria is that we sometimes do early morning sun to treat jaundice. Please do not.
Please do not. Very dangerous
So
practice.
why?
Hello again. Welcome back. This time I am going to speak about neonatal jaundice. Okay, very, 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 very common anywhere in the world. Okay, about 60% of term babies get jaundice, and about 80% of preterm babies get jaundice. What is jaundice? Jaundice is the yellow sort of coloration you find in Caucasian babies or lighter skinned babies. Very easy to see. You just look, baby looks jaundice. But for us in Nigeria, especially but the more darker skinned babies, it's quite difficult to see if a baby is jaundice. So the best thing to do, or best places to look at the eyes. You know, the whites of the eyes will be yellow, and also just press on the nose for a few seconds, let go, and the before the blood flow comes back, you see like a yellow coloration on the nose. Okay. So what causes jaundice? Now, when babies are born, their blood is more concentrated than older children and adults. Okay, because they've been in the womb, so the oxygen supply is not too great in there, so they sort of need more red blood cells to, keep things going. After they're born and they're breathing on their own and their oxygen levels are, higher, they don't need all those red cells anymore, so the body breaks them down. When red cells are broken down, you get the end result is a pigment called bilirubin. Okay, what tends to happen normally? It goes through the liver. The liver it's called conjugation. The liver conjugates the bilirubin and it's excreted in the poo. So that's what makes poo brown as well. Most of it is excreted in the poo, a little bit in the urine. Okay, so that's what jaundice is. Now, sometimes in neonates, the levels go higher than we would like, and we treat with something called phototherapy. It's just I'm sure a lot of you have seen it. It's like a bright light, like a white blue light. Okay, and that breaks down the bilirubin. Okay, and it's excreted. Now, why do we treat jaundice? For one reason and one reason alone: to protect the brain. Because if the baby has high jaundice levels, that bilirubin can cross the blood-brain barrier and get to a part of the brain called the basal ganglia, which sort of deals with coordination of movement, things like that. So if this bilirubin gets to that part of the brain, it causes damage, and the baby can end up with something called cerebral palsy. Okay, so the only reason we do the treatment is to protect the brain. So the best day to check for this jaundice is on day 3 of life. Okay. Sometimes jaundice can present earlier in the first 24 hours. We call that pathological. So if you see your baby is jaundice in the first 24 hours, that's not right. Again, seek medical attention for the level to be checked. But if the baby is generally well otherwise, ideally day 3, the baby should be checked for jaundice. Okay. My co-founder of my unit where I practice, she did a study like some years ago. Dr. Dosekun, Dr. Efumbo Dosekun. She did a study a few years ago, and she went out there, checking about, jaundice, and they actually picked up quite a few. I've forgotten the percentage now, but it was quite a few, like high levels of bilirubin, which otherwise they would have been at home, and developed something called kernicterus. That's what the condition is called. It's called kernicterus, which ends up with cerebral palsy. So please, very important. Your baby looks a bit yellow, even if it's day 2, day 3, day 1, just go. Let them just check a level. It doesn't always have to be an invasive test, a blood test. There's something called the TCB, transcutaneous bilirubinometer. It's just a gadget. We just put it on the forehead, and it gives us the level. And if it's high that way,
Do you have that in your
yeah,
facility?
we do. We have that.
Love it.
We have that. And if it's high, then we have to go on to do a blood test and treat if required. Okay. So please, if your baby looks jaundiced, just check it out. Let your baby see a doctor. They can do levels, and then they can tell you whether it's high or whether it's nothing to worry about. Okay. So anything to add, my colleagues here?
Dr. Rena.
Okay, so jaundice is literally the commonest thing you see in newborns. It's so common.
Very common.
I think the only thing I'll add about jaundice, really, I mean, you really said it all, is that when a mother is rhesus negative, so for instance, if you are maybe O negative or B negative, that negative is a mother's rhesus blood status. So any mother that's rhesus negative has a higher chance of having a child that has severe levels of jaundice. And so what I'd say is, if you're rhesus negative as a woman, please make sure that you are liaising with your obstetrician, to liaise with the pediatrician, so that we can identify jaundice as early as possible. Then avoid mentholatum, avoid rubbing mentholatum on babies, because there are some babies that can develop really terrible levels of jaundice because you rub mentholatum on them. Yeah.
Okay, thank you for that. Actually, I also want to bring this point of breastfeeding and formula feeding. There is what we call
Breast milk jaundice.
breastfeeding jaundice and breast milk jaundice. And sometimes when moms don't have the breast milk coming in like like it should, that can cause dehydration in the babies, and then they're not excreting the bilirubin like they should, and they could have high levels. So in Nigeria, there was that push generally of, oh, you must breastfeed. And many times, if the mom's milk hasn't come in, then the baby is sucking at the breast, trying to get the colostrum, but the mom's milk might take up to a week or 10 days to come in. So I tell parents, don't feel guilty. You can always give them formula until your breast milk comes in, because they feel bad that, oh, I wanted to breastfeed my baby and now I can't. And now exclusively, and there's nothing wrong with doing the formula until your breast milk comes in. So it's just something that you want to make sure that parents are not feeling guilty about, because their milk hasn't come in and then the bilirubin level doesn't go so high.
Good
So,
point.
and then the other thing is there's a breast milk jaundice where the breast milk is displacing the bilirubin from the binding site, and at the end of the day, the baby's bilirubin goes up. Now, there's different types of jaundice too. I had a child who was born in the US and came home, and the child was like 2-3 weeks old, and they had conjugated hyperbilirubinemia. That child had an abnormality of the gallbladder and had to get a Kasai's procedure where they had to
It has to be
basically
done within a certain time
yes,
frame. Yeah.
and it was one of our popular surgeons that did. He's a pediatric.
Okay.
He's a pediatric surgeon. In fact, they always show him in America as one of the Nigerian surgeons that has done. So I called him. I said, "Hey, I'm sending this baby back to you because the baby was born there in Texas Children's." And I sent the child back to Dr. Lutoye, who's a celebrated pediatric surgeon. And he's like, "Oh yeah, send the baby," and we took care of the baby, and everybody's happy.
That's a very good point, actually.
And
because
everybody's
by the
happy.
time the baby's like 2 weeks old, a term baby,
Yes,
it should
and
not
still
be
jaundice.
It should not be jaundice. So that's a very good point you've touched on as well.
Because it couldn't come before the baby was a month. The baby was about 5 weeks.
So I guess
Yes.
so after 2 weeks, maybe so jaundice, look for why that's happening. The other thing, of
Yes,
course, is
yes.
sometimes what's common here in Nigeria is that we sometimes do early morning sun to treat jaundice. Please do not.
Please do not. Very dangerous
So why?
practice.
Why is
Because
that?
imagine this hot Nigerian sun. You put a new, even me as an adult, it's hard, exactly. Imagine a newborn, their skin is still quite thin. It's not fully mature. You put them out in the sun, they get dehydrated, heat stroke. They get really unwell. Please don't do that. Okay, it's better to treat it properly in a hospital. And other things touched on this as well. I've heard they boil pawpaw leaves and use the water to bath the baby
and drink.
No, please don't do
Oh.
that. Another one I've heard, give antibiotics. No, please don't do that. Things like that. So just go to a hospital, just seek medical attention and get it treated properly. And I was going to touch on something else you mentioned as well.
Rhesus.
Skip the rhesus, yeah. So the rhesus, when you're pregnant, if you're rhesus negative, very important point. I think you get an injection called Rogam.
Yeah.
So please get it done, and you get it again after the
I think
after
you get
the
it twice in the
two.
pregnancy.
Oh, is it
Yes.
twice in pregnancy? Okay.
Yes.
And you get it again after the baby.
After the
That's a baby
Yeah,
born,
yeah.
yeah.
It's very important. And with this rhesus incompatibility he's talking about, it tends to get worse with every subsequent pregnancy.
Because
So the
mom is
first-
producing more
and more
antibodies.
antibodies. Because the first two pregnancies may not be so bad, but then the third, fourth, the baby is worse, actually. So take that very seriously as well. Okay. All right.
All right, thank you.
Thank you very much.
Well done.
Okay, thank you.